My name's Heather Lewis and I'm a clinical nurse specialist for soft tissue infections and cellulitis. I'm also the lead for the pressure injury working group within Counties Manukau Health.
Okay. Hi there. How are you doing?
Pressure injury prevention is around the patient and reducing harm to our patients. A pressure injury is a localised damage to the skin or tissues, and it's usually over a bony area, so it could be on the elbows, the heels, the sacrum, and it's a sustained damage to the skin, and that could also be down to the bone. So the pressure injuries are staged according to their depth of injury. Over the last 7 years, when we first started, we were at 10.4% prevalence of hospital-acquired pressure injuries. The most recent audit that we completed in May 2016, we were at 1.76%. Overall, that's an 83% reduction of hospital-acquired pressure injuries within Counties Manukau Health. We have nurses, we have charge nurses, dietitians, occupational therapists, also biomedical engineers looking at the mattresses, and it's a multidisciplinary approach to pressure injury prevention.
It's really important during the admission process that we do the risk assessment, because that's how we are able to determine what sort of a specialist equipment that we might need for the patient. We're checking their skin integrity, making sure they don't have any red areas already. We're providing them with the correct equipment that they need while they're in hospital so that they don't actually get any pressure injuries. We're encouraging them to adjust their position frequently. Moving around, mobilising is huge. Also adequate intake, oral intake, hydration, all of those things are really key.
The interventions that we've implemented across counties, first of all patients are assessed on admission to a ward area to identify any high risk for pressure injuries. There are what we call bundles of care implemented, and this is around ensuring that pressure is being relieved. So regular turns, mobilising, making sure the patients are getting up out of bed if they're able to, making sure they're getting the good nutrition, plenty of fluids, making sure they're clean and dry when they're incontinent. We have access to pressure relieving mattresses.
We've got a fantastic resource which is a equipment decision tree, which basically we look at and we decide whether or not certain equipment is appropriate for the patient, and that's what we use to provide the best possible care that they can get in hospital with equipment. Okay, so we're going to be just checking your skin integrity. And
it's been exciting to see the growth and development of the pressure injury working group, and also the wound care resource nurses who are within the ward areas. We have 80 wound care coaches within the inpatient setting who have been pivotal to assist with the prevention of pressure injuries. Sometimes we can see representations of patients with pressure injuries back into the acute hospital because the interventions haven't been maintained in their own home environment. The challenge for us now is to look at how we can develop further. The areas we'd like to focus on are in the community and age residential care facilities.